Welcome to our session on Medicare and Medicare Advantage. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. First, I want to welcome you to the Asclepius Initiative. You might be wondering about our name, as it certainly is unique. Asclepius comes from Greek mythology, and it represents medicine and healing. And our goal of the Asclepius Initiative is to raise awareness and promote change to make continuous, high-quality, affordable healthcare coverage a reality for all. Let's get into the specifics of Medicare. Medicare is the federal healthcare program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease, so permanent kidney failure requiring dialysis or a transplant, sometimes called ESRD. There are 4 parts to Medicare. Part A covers hospitals, hospice, and skilled nursing care. There's no charge to most Medicare beneficiaries for Part A premiums, but deductibles and coinsurance apply. Part B covers doctor services, outpatient care, and preventive services. Income-based premiums apply along with an annual deductible and 20% coinsurance. The cost of Part B premiums vary according to income level, with higher income individuals paying more on a tier-based schedule. Costs also include an annual deductible and 20% coinsurance. Part C is also known as Medicare Advantage. Coverage is the same as Part B. Medicare Advantage benefits may also include dental and vision coverage, fitness, and meals. It's provided by private insurance carriers and requires payment of Medicare Part B premiums. Some plans have additional premium costs. These plans may impose restricted networks, pre-authorization requirements, and referrals for specialist care. Part C usually covers medications. Part D is for medications only. It's administered by a private company. For 2026, there is a $2,100 limit on maximum out-of-pocket costs for covered medications. Costs vary according to the plan and income level. Be aware that if you do not sign up for Medicare within the required timeframes, financial penalties are imposed that can last your lifetime. Individuals who do not sign up for Medicare Advantage plans have the option to select a Medigap policy. Medigap policies are sold by private insurance companies and are used to help pay out-of-pocket costs for services under Medicare Parts A and B, such as the coinsurance and deductibles associated with Parts A and B. For example, the 20% coinsurance required for doctor's visits under Part B, or the hospital deductible for Part A. If you sign up for a Medigap policy at the time you become Medicare eligible, the insurance companies are required to issue you a policy at the standard rate. You cannot be denied based on health status. Eligibility requirements are the same as for Medicare Part A. The providers for Medigap are any providers that accept Medicare. There are 10 different standardized Medigap plans. You can learn more about them on the Medicare website at medicare.gov. Another really important thing to know is that if you opt to go with a Medicare Advantage plan and you decide after a few years that it no longer meets your needs and you want to switch to traditional Medicare, perhaps you want to spend part of the year in a different state, or you have multiple medical problems and the pre-authorization requirements are preventing you from getting the care that you need, it can be very expensive or even impossible to obtain a Medigap policy because the guaranteed issue rule no longer applies. Even though Medicare Advantage is also known as Medicare Part C, rather than being a part of Medicare, it's actually an alternative to traditional Medicare. Medicare Advantage plans are administered by private insurance companies approved by Medicare, and they bundle Part A, Part B, and often Part D coverage into a single plan. They may include additional benefits such as vision, dental, and wellness programs. Medicare Advantage plans typically operate under managed care type arrangements, including health maintenance organizations, HMOs, preferred provider organizations, PPOs, and private fee for service plans. While both traditional Medicare and Medicare Advantage are underwritten by the government, there are key differences in how they are run and how they function. Traditional Medicare is administered by the federal government. The program usually involves higher out of pocket costs, including deductibles and coinsurance, although beneficiaries can supplement coverage with what are known as Medigap policies. Medigap plans can cover the deductibles and coinsurance costs associated with traditional Medicare. On the other hand, Medicare Advantage plans are run by private companies. The government pays these private plans a certain amount of money per enrollee per month to administer the plans. If the plans pay out less in benefits and overhead than they receive from the government, they get to keep the difference as profit. Medicare Advantage plans may offer lower premiums and out of pocket expenses compared to traditional Medicare. They may also offer perks such as gym memberships. However, they frequently require copayments for services, and they can and do restrict the choice of providers that patients can use. For example, they may limit choice to only one cardiology group or hospital in town, or they may restrict the geographic distribution of providers, such as covering only providers within a particular county or state. Another important difference is that Medicare Advantage plans typically employ pre authorization requirements for various services, while this used to be rare with traditional Medicare. However, traditional Medicare is now piloting pre authorization policies in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington, although not in Kentucky at this time. Commercial plans have what are called network structures, which govern who you can see for healthcare services. Whether a provider is in network or out of network is based on whether or not they have a contract with the particular insurance company or plan. Networks exist to control cost and purportedly quality. They can make it difficult, if not impossible, to obtain necessary care, especially for those who live in an area that has few providers overall or who have conditions that require specialists or the use of a major referral center. In network refers to health services providers who have a contract with a particular insurance plan to deliver care at pre negotiated rates. Depending on the size of the organization providing the care, the idea of negotiated rates may be more in theory than fact. Out of network, on the other hand, refers to any healthcare provider or facility who do not have a negotiated contract to deliver services under your health insurance plan. Some plan structures do not offer any out of network benefits, which means if you use an out of network provider, the plan will not cover the care at all. Other plans do offer out of network benefits. However, in those cases, the member responsibility is typically greater than when using in network providers or facilities. For example, a plan may require 20% coinsurance of in network care and 30% coinsurance for out of network care. Using out of network providers can and almost always will result in higher out of pocket costs than seeing in network providers. So, when choosing between Medicare and Medicare Advantage plans, consider factors such as your healthcare and your medication needs, your budget, preferred doctors and hospitals, and whether or not you'll likely want or need medical care somewhere other than your location of primary residence. You'll also want to review any Medigap or Medicare Advantage plan benefits, cost, network, and quality ratings before making a decision. Ways to apply for Medicare include online at Social Security. It's the easiest and fastest way to sign up and get any financial help you may need. You'll need to create your secure My Social Security account to sign up for Medicare or apply for benefits. You can call Social Security at 1 800 772 1213. TTY users can call 1 800 325 0778. You can contact your local Social Security office. And if you or your spouse worked for a railroad, call the Railroad Retirement Board at 1 877 772 5772. When you apply for retirement or disability benefits from Social Security or the Railroad Retirement Board, it also serves as your application for Medicare. Once you get approved for Social Security or Railroad Retirement Board benefits, you'll automatically get Part A coverage once you're eligible for Medicare. You can choose whether or not to enroll in Part B. If you want to get higher monthly Social Security benefits by waiting until after age 65 to sign up for Social Security, make sure that you only sign up for Medicare rather than Medicare and Social Security when you turn 65. Like all types of healthcare coverage, Medicare can get really confusing really quickly. In fact, you might already be confused just listening to me. For assistance, you can contact your state health insurance assistant program, or SHIP. SHIP provides information, counseling, and assistance to seniors and disabled individuals, their families, and caregivers. This service is provided at no charge. You can get more information on SHIP by going to shiphelp.org. It's important to sign up for Medicare or Medicare Advantage coverage during your initial enrollment period, unless you have other coverage that's similar in value to Medicare, such as from an employer. If you don't, you may have to pay an extra amount called a late enrollment penalty. Late enrollment penalties are added to your monthly premium, are not a one-time late fee, may be charged for as long as you have that type of coverage, and for most people, that's a lifetime penalty. And they go up the longer you wait to sign up. They're based on how long you go without coverage, similar to Medicare. Part A, late enrollment penalty. Most people who are 65 and older who are eligible for Medicare and have worked and paid Medicare taxes for at least 10 years are not required to pay a Medicare Part A premium. There is also no premium for Medicare eligible individuals who are younger than age 65. If you are in a situation where you do not qualify for free Part A coverage and you fail to sign up and pay for Part A on time, your monthly premium may go up by as much as 10%. The penalty duration is for twice the number of years you didn't sign up. For example, if you failed to sign up for 2 years, you'll pay the penalty for 4 years unless you meet criteria to sign up for Part A during a special enrollment period. The majority of people need to sign up for Part B when you become eligible. Generally, you won't have to pay a Part B penalty if you sign up on time or qualify for a special enrollment period. If you do not sign up when you're first eligible, you will incur a penalty of 10% for each year that you failed to sign up. This penalty is added to your monthly premium and is permanent. This penalty does not apply if you are Medicare eligible but choose to have qualified health insurance through your employer or through your spouse's work. There are also what are called special enrollment periods, where if you experience certain specified life changes, you're allowed to enroll outside of regular open enrollment. These include you or your spouse, you're still working, and your job based insurance coverage ends. You lose other health coverage, not your fault. You move out of your plan's service area, or other specific situations like qualifying for Medicaid. You will incur a penalty if you fail to get a Medicare drug plan when you first go on Medicare. The cost of the late enrollment penalty depends on how long you went without Part D or creditable prescription drug coverage from the time you first sign up with Medicare. Creditable drug coverage refers to prescription drug coverage that, on average, is likely to pay as much as Medicare drug coverage or more. The penalty is an extra 1% per month. Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, and this is an amount calculated by the Centers for Medicare and Medicaid Services each year, and it's $38.99 in 2026, times the number of full uncovered months you didn't have Part D or creditable coverage. The monthly premium is rounded to the nearest tenth and added to your monthly Part D premium. The national base beneficiary premium may change each year, so your penalty amount may also increase or decrease each year. Here is an example. Maria was first eligible for Medicare in January 2024, but didn't sign up for a Part D drug plan. She finally signed up in January 2026. She went 24 months, which is 2 years, without drug coverage. The penalty is 1% of the national based premium, so $38.99 in 2026, for every month you go without coverage. So Maria will pay her plan's regular monthly premium plus an extra $9.36 every month, and she'll keep paying that penalty for as long as she has Medicare drug coverage. Medigap and Medicare Advantage plans. A Medigap policy is different from a Medicare Advantage plan or Part C. A Medicare Advantage plan is an alternative to traditional Medicare, whereas a Medigap policy is a supplement to traditional Medicare coverage. You can only have a Medigap policy with traditional Medicare coverage, but not with Medicare Advantage. If you find you don't care for Medicare Advantage after you choose it for the first time and you want to switch back to traditional Medicare, you have 12 months to re-enroll in the Medigap policy you had if the company still sells it. Beyond this trial period, you may find it more expensive or even impossible to purchase a Medigap policy, depending on your health status. There are 10 standard Medigap plans. Depending on the plan, coverage may include coinsurance costs for hospitalizations and medical services, hospice and skilled nursing, deductibles for Parts A and B, and medical emergency services when traveling abroad. This chart shows basic information about the different benefits Medigap policies cover. A check means the plan covers 100% of this benefit. An X means the plan does not cover this benefit. A percentage sign means the plan covers that percentage of this benefit and you're responsible for the rest. NA means not applicable. So, when is it the most important to think about your coverage and whether or not you need or want to make a change? There are two time periods when you can make changes in your Medicare or Medicare Advantage plans, but they differ slightly in what you can and cannot do. During Medicare open enrollment period, which runs between October 15th and December 7th each year, you can join, switch, or drop a Medicare Advantage plan. You can change from traditional Medicare to Medicare Advantage or from Medicare Advantage to traditional Medicare. You can also change your Medicare Part D coverage if you have traditional Medicare. Coverage begins on January 1st as long as the plan receives your request before December 7th. Medicare Advantage open enrollment period takes place between January 1st and March 31st of each year, and contrary to what the name would imply, is for those already enrolled in Medicare Advantage. During this time, you can make the following changes. You can change to another Medicare Advantage plan with or without drug coverage. You can discontinue your Medicare Advantage plan and go back to traditional Medicare. Additionally, you'll be able to sign up for a Part D drug plan. You cannot go from traditional Medicare to a Medicare Advantage plan during Medicare Advantage open enrollment unless you are within the first 3 months of getting Medicare. You can only make one change during Medicare Advantage open enrollment. Coverage begins on the first day of the month after the plan receives your request. Keep in mind that if you leave a Medicare Advantage plan to go on to traditional Medicare and you want to purchase a Medigap policy, as I've noted, your health conditions can affect your premium rate and whether or not you are able to obtain Medigap coverage. Medicare spending is over $1 trillion a year. When there's that much money to be had, there will be those who want to take advantage of any opportunity they can create to get it, which can be a consumer nuisance at best and criminally harmful at worst. There are several ways for scammers and brokers to take advantage of you. Your Medicare number is valuable. Protect it. CMS has changed Medicare IDs from Social Security numbers to secure, randomized Medicare beneficiary identifiers, or MBIs, to help fight identity theft. Scammers may contact beneficiaries claiming that Medicare is issuing new plastic cards, chip cards, or metal cards. They demand immediate verification of the beneficiary's Medicare number under threat of coverage cancellation. Medicare will never call to verify your card. Medicare cards are paper, not plastic, and they're free. Remember, Medicare never issues plastic, chip, or metal cards, and they will never call to ask you for your number. Offers of durable medical equipment should raise suspicion. Durable medical equipment, or DME, fraud represents one of the largest drains on Medicare program funds. Scammers aggressively market medical supplies like back or knee braces, diabetic aids, or testing kits, claiming they are free of charge to lure the beneficiary into supplying their MBI. Fraudulent perpetrators then use the stolen identifiers to submit high volume, unauthorized claims to Medicare for expensive equipment that was never requested or received. Another problem is scammers who prey on residents of long-term care facilities. This can take the form of unauthorized credit card purchases or billing Medicare for services that were unnecessary, were delivered by unlicensed or unqualified personnel, or did not take place at all. Yet another technique used by spammers is to spoof caller IDs to make it look like Medicare or government is calling. The tactic: they tell the recipient that their Medicare coverage is about to be canceled or that they are owed a refund due to a billing error requiring immediate verification of banking info or their Medicare card number. The reality: Medicare will never call you unexpectedly to demand personal information or financial details. Find information at Medicare.gov to review the rules of how Medicare interacts with you. Employees of Medicare will never threaten to cancel your plan, demand money over the phone, or call to sell you a product. Private commercial vendors may use deceptive mailers to trick beneficiaries into believing that they are receiving official communication from the federal government. Some ways in which they do this include using government seals, red, white, and blue accents, or wording like official Medicare record to command false authority. Prompting fast action on misleading postcards to secure benefits, masking what is actually a private sales leads generator, and mimicking CMS designs solely to obtain your personal contact details, which are then sold to or used by commercial plan vendors. This is a real example of an unsolicited communication which appears to represent a path to enrolling in Medicare. However, it is from someone selling health insurance plans, not from the Federal Centers for Medicare and Medicaid Services. The postcard uses colors associated with Medicare and has the word Medicare in the text. As you can also see, the information which reveals their true intentions is intentionally in a much lighter type color, less noticeable and harder to read. Both CMS and federal law strictly prohibit private brokers and insurers from employing misleading names, logos, or styles that imply state endorsement. Under the Social Security Act, it is illegal for private entities to use Medicare or related terms or symbols in a manner that falsely implies government approval or association. Medical identity theft is a serious crime that happens when someone uses your personal information without your consent to commit Medicare fraud or other crimes. Use the following tips to protect yourself from becoming a victim. To protect yourself, do not share your Medicare number. Guard your Medicare card like a credit card. Never give the number to anyone who calls or visits uninvited. Check your monthly Medicare bills for Part B and Part D premiums to make sure the amounts you are being charged are correct. Review your Medicare summary notices, MSNs, or explanation of benefits, EOBs, to ensure that Medicare isn't being billed for services or equipment you never received. Report suspicious activity immediately by calling 1-800-Medicare, which is 1-800-633-4227. Thank you for coming to our session on Medicare. Last step, please take our survey, the QR code to the left. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. The middle QR code will take you to our educational materials on the TAI website. We have a lot of amazing free resources on our website, and I encourage you to check that out. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan the QR code to the right to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.